This disease is caused by an organism named Pseudomonas syringae. There's two types of Pseudomonas syringae that cause bacterial canker. We categorize them as Pathovar syringae and Morus spinorum. On sweet cherry, it's the Pathovar syringae that causes the most damage. Basically, the problem we have with this organism is it's difficult, in fact almost impossible to control, because for the most part the organism is internal inside the tree, and most of the varieties that we grow for sweet cherries in Michigan are highly susceptible to the disease. There's very little known tolerance or host resistance to this disease. The canker organism colonizes buds, and it overwinters in both dormant buds on the tree and in cankers that form on the tree. And what happens is, as these buds unfold in the spring, the pathogen moves right with them. And in Michigan, conditions during spring are commonly cool and wet. Those are optimal conditions for growth of the canker organism Pseudomonas syringae. And basically what's happened here is these flowers have been all colonized. As they emerge from the bud, the pathogen grows to large numbers on them, and then it has a trait which is called ice nucleation active. The bacterium can actually catalyze ice formation as temperatures drop only slightly below freezing. In Michigan during this spring, we've had many events of freezing conditions, but even where temperatures drop to quite cold, 22 to 25 degrees. And under those kinds of conditions, the ice nucleation activity is not even that critical. We're going to have frost damage no matter what. And that's what we've seen here. We've seen basically every cluster on this tree has been damaged by frost and due to the colonization of the pathogen. During research that we've conducted over the past several years, we basically detect Pseudomonas syringae on every flower cluster in every sweet cherry orchard that we sampled in Michigan. The bacterium is that pervasive and that common. And what can happen under severe conditions such as this is the freeze injury and the death of the flowers can be followed by invasion by the pathogen into the woody stem tissue and subsequent canker formation. If this happens, a tree like this would be tremendously affected by canker, and it would be very difficult to keep this bacterium under control in subsequent years. Normally, older trees like this one are less susceptible to extensive wood invasion and canker symptoms caused by the pathogen. It's younger trees that are in the range of, say, up to 7 or 8 years old, that are much more highly susceptible to canker formation and then subsequent further systemic invasion or movement by the pathogen inside the tree, throughout the tree, ultimately causing death of the tree. That's normally accompanied by large canker formation and extensive gummosis of the tree as an attempt to wall out the pathogen, but that's often unsuccessful. On these trees, there's really only two potential outcomes from this episode of frost injury and bacterial canker infection from this year. One is that if the frost injury is severe enough and the injury continues into the wood, the bacteria would be able to readily colonize the wood at the base of each of these clusters and cause a canker. And we'd come back later and this branch would be heavily cankered. Essentially, this whole tree would be heavily cankered from this event. The other is, if the frost injury was not severe enough, then the infection will stop where we see it here, and the tree will be able to continue to grow and outgrow this infection event. And that's because bacterial canker wood invasion, we find it to be heavily influenced by the extent of frost injury in these kind of bloom periods of frost in these kinds of events. In other situations with bacterial canker, we will see large cankers on stems, on the main trunk of the tree, wherever the bacterium has successfully colonized, either colonized wounds, colonized pruning wounds, or potentially moved systemically through the tree and colonize the site. Now these trees in this orchard look very good. We don't see existing cankers on the branches, which is a really nice thing. But one of the counter aspects of bacterial canker is that even on very clean looking trees, the bacterium is still there, still very widely colonizing the tree, still present in dormant buds, and so that can lead to a frost-induced situation such as we've seen this year.